Hello students, welcome to EPG Pathshala. I am Rashmi Sinha from the Faculty of Anthropology, Indira Gandhi National Open University. Today, we are going to discuss the module Impact of Government Programs under the paper Research Methods and Fieldwork. The learning outcome of the module will be like, after studying this module, you will be able to understand what is a government program and why do the programs need to be evaluated. 2. Learn when a program needs evaluation and what are the various evaluation methods, and to identify why impact evaluation methods have shortcomings. First of all, let us get introduced to what is a government program. A government program is a program or activity sponsored or administered by local, state or national government. A majority of such programs fall under the realm of welfare. The term welfare is loosely defined as the minimum level of well-being and social support of its citizens by the modern nation state. Britannica Online Encyclopedia defines a welfare state as a concept of government in which the state plays a key role in the protection and promotion of social and economic well-being of its citizens. It is based on the principles of equality of opportunities, equitable distribution of wealth, and public responsibility for those unable to avail themselves of minimal provisions for a good life. The general term may cover a variety of forms of economic and social organization. Even though welfare systems differ from country to country, the common thread is about providing for individuals who are unemployed, have illness or disability, elderly, or those with dependent children and veterans. Welfare can take many forms like monthly payments, housing, and other assistance, subsidies and vouchers. One of the first programs launched by the Government of India after independence was the Community Development Program, which is abbreviated as CDP. It was launched in 1952. The CDP was a follow-up to the pilot launched in 1948. The program was launched for 55 districts, each covering about 300 villages or a population of 30,000, aiming at socio-economic transformation of rural people. The National Extension Service was inaugurated on October 2, 1953, with the view to provide necessary manpower for the implementation of the Community Development Program throughout the country. Consequently, the government has launched various programs, some of which are: in 1960 and 61, Intensive Agriculture Development Program (IADP) was launched to provide loan for seeds and fertilizers to farmers. In 1966-67, High Yielding Variety Program to increase the productivity of food grains by adopting latest varieties of inputs of crops. 1972 and 73 saw Accelerated Rural Water Supply Program ARWSP launched for providing drinking water in villages. In 1975, Command Area Development Program CADP for better utilization of irrigational capacities, and 1980 Integrated Rural Development Program IRDP for overall development of rural poor. 1983 saw Rural Landless Employment Guarantee Program RLEGP being launched for employment to landless farmers and laborers. 1986 Self-Employment Program for the Poor SEPUP for self-employment through credit and subsidy. 1995 Prime Minister Integrated Urban Poverty Eradication Program PMI UPEP to eradicate urban poverty, and 2004 saw the National Food for Work Program launched NFWP to supplementary wage as food grains for work. Impact evaluations of government programs are needed to give a feedback to policymakers on the range of issues, which include efficiency of a program, need for scaling up working interventions, adjusting program benefits, and difference between various program alternatives. They are also particularly effective when applied to pilot programs that are testing a new and unproven approach that looks promising on paper. Now let us discuss the impact evaluation and evaluating an impact and impact evaluation. Gardner et al. In 2011 defined impact evaluation as a particular type of evaluation that seeks to answer cause and effect questions. Unlike general evaluation, which can answer many types of questions, impact evaluations are structured around one particular type of question. What is the impact or the causal factor of a program on an outcome of interest? As impact is defined as a marked effect on influence, when we ask a question, what is the impact of a particular government program, we need to first determine the field in question and define the metrics for measurement of performance. For example, one can look at the impact of the National Food for Work program in respect to the following treatment: increasing nutrition level in households, increase in school enrollment, the new community structures spawned, the changed nature of politics in village, increase of household saving in formal banking sector. Each of the above falls under a different field, that is, nutrition will fall under health, school enrollment under education, and so on. After having determined the field of treatment, one has to set the metrics for measurement. For example, under nutrition, we are looking at all girl children in the age group 0 to 5 years, and from what level of current nutrition level to what nutrition level does the program target to make an impact. So, most of the time when a user uses the term impact, he or she means what the program produced. Impact actually, on the other hand, is the purview of rigorous evaluation, means something else. Impact means the causal effect that a program has an outcome that we care about. Taking the above National Food for Work program example, one can say the program is a success as it is benefited, say, 1 million households, and one can say with confidence that the program is functioning. But this metric does not tell us whether the program has the impact that we desire, because what the government really cares about, which is the program runs, is say to increase the nutrition intake of parents and children and increase of food security of households, and that people are not skipping meals. Those are the impacts the program should care about. Hence, defining what the government cares about is the start and the first part to determining the impact of program. The second part of the study being what is called causal impact, or what the program is leading to directly. For example, does National Food for Work program NFWP lead families to totally depend on the government and not supplement their income from other sources? Lance, Gulke, Hattori and Angelis in 2014 in their article, "How do we know if a program made a difference?" state, "We would like to estimate program impact by measuring the difference in outcome for a sample of individuals holding everything but their program participation constant." Unfortunately, this is not possible. We cannot observe an individual's outcomes while varying their participation status in a program and only their participation status in that program. Within the framework of varying exposure for the same individuals, we are therefore reduced to at most considering differences in outcome over time for the same individual as the program participation varies. They then argue the alternatives to the above methodology, that is, see how the program impacts two different individuals, one a participant and the other a non-participant. However, recording this isn't simple either, because unlike controlled laboratory conditions, humans in real world interact with situations based on conscious decision, based on cost benefit analysis. Hence, both the participants and non-participants differ in many more ways than just the experience of the program participation. This in itself would introduce a difference in measurement of impact of the program. The first step, hence, in any program impact evaluation is to characterize the parameter one wishes to capture. Let us simplify the above concept by taking the example of a drug test to find the impact of a particular drug on, say, lab rats. The impact testing is done by separating the rats into two groups, one which the drug is tested and the other called control group on which the drug is not tested. Assignment of rats between the two groups is typically completely random. This random assignment ensures that the rats are alike on average so that their peculiar or individual differences are statistically cancelled out when comparing average outcome between the two groups. There is then an attempt made to ensure that their experiences in the course of experiment vary only in terms of the exposure to the drug, with no difference between the groups in the terms of food levels, veterinary attention, etc. during the experiment. Hence, to assess the average impact of the drug, it is necessary only to compare mean, that is average, in the control and the treatment samples of the parameter one wishes to capture. The above simplistic example on impact analysis in lab conditions is turned on its head in a messy real-life human world, as one can longer control variables that apply on participants besides the constant application of a program. Even the guaranteed constant and uniform implementation is itself a suspect in real life conditions based on human subjectivity and other implementing conditions. A case in point is the midday meal scheme of Government of India, a school meal program designed to improve the nutritional status of school-age children nationwide. The midday meal program was launched by Indian government in August of 1995 to boost enrollment, retention and attendance rates for the children while also improving nutrition and health outcomes. Supreme Court in its order dated 28th of November 2001 under Right to Food campaign mandated all government and government assisted primary schools to provide cooked midday meals, a decentralized scheme. The meals are cooked on site by local cooks and helpers or self-help groups. The decentralized model helps serve local cuisine besides providing jobs in the area and minimizing waste, as well as better monitoring by parents and teachers. However, in spite of years of experience and the advantages of decentralized midday meal scheme, in July of 2013, 20 children in a school in Bihar died after consuming the midday meal, presumably from grain contaminated with organophosphates, negating confidence in the scheme. This was reported by Kumar in 2013. How do we then measure the impact of midday meal scheme then? Evaluating an impact, most evaluations of impact choose a methodology that relies on an estimate called counterfactual, that is, what the outcome would have been for program participants if they had not participated in the program. As detailed above, even though it is not the perfect method to measure impact, in real life condition, it is possible to keep other variables same except the participation or non-participation in the program. Hence, evaluators normally find a comparison group to estimate what would have happened to the program participants without the program. The basic evaluation question asked is the impact or causal effect of the program of an outcome of interest. This can be applied to many contexts. For example, does Food for Work program FFWP improve nutritional levels in the household? Does FFWP increase school enrollment? Or does it decrease infant and child mortality? Gertler et al. In 2011 list out the reasons why a program needs an evaluation, that is, innovative, it is testing a new promising approach, replicable, the program can be scaled up or can be applied in a different setting, strategically relevant, the program is a flagship initiative, requires a substantial resources, covers and could be expanded to cover a large number of people or could generate substantial savings. Untested, little is known about the effectiveness of the program globally or in a particular context. influential. The results will be used to inform key policy decisions. Impact evaluations can be done in two ways, that is prospective or retrospective. A prospective evaluation involves determining criteria designed and built into program implementation with baseline data collected prior to the program implementation for both the implementation and comparison group. On the other hand, retrospective evaluation assesses program impact after the program has been implemented with no baseline data. A simple way to calculate the impact or causal effect of a program P on an outcome of interest X is given by the basic impact evaluation formula. X divided by P is equal to 1 minus X divided by P is equal to 0. This formula says that the causal impact of a program on an outcome is the difference between the outcome with the program and the same outcome without the program. For example, if P denotes the food for work program FFWP and X denotes income, then the causal impact of FFWPA is the difference between a person's income X after participating in the program, that is P is equal to 1, and the same person's income X at the same point in time if he or she has not participated in the program, that is P is equal to 0. Hence, the evaluator would like to measure income at the same point in time for the same unit of observation, but in two different states of the world. The evaluator observes how much income the same individual would have had at the same point in time, both with and without the program, and thus concludes that the only possible explanation for any difference in that person's income would be the program. By comparing the same individual with herself at the same moment, the evaluator manages to eliminate any outside factors that might also have explained the difference in outcomes and concludes that the relationship between the FWWP and income is causal. This basic impact evaluation formula is valid for anything that is being analyzed, that is a person, a household, a community, or any other unit of observation that may receive or be affected by the program. The formula is also valid for any outcome X that is plausibly related to the program at hand. Once we measure the two key components of this formula, the outcome X, both the programs and without it program impact questions can be answered. However, there is still a problem for the evaluator. He can observe a measure of the outcome X for program participants X when P is equal to 1. There are no data to establish what their outcomes would have been in the absence of the program X when P is equal to 0. The term X divided by 5 is equal to 0 represents the counterfactual when the participant has not participated in the program or in the absence of the program. To do this, the evaluator uses a comparison group, also called a control group. After setting the program and the control group, it is important how the evaluator interprets the result. Depending on what the treatment and the control group actually represents, the interpretation of the impact of a program will vary. All the methods of selecting control group has high risk of bias by the evaluator. The most important parameter of impact evaluation method depends on the rules of the program follows for enrolling participants. One of the most reasonable and transparent way for allocating scarce resources among equally deserving population is by giving everyone who is eligible an equal opportunity to participate in the program. A randomized selection is one which typically reduces the risk of a bias and the best way to evaluate the impact. Randomized assignment is essentially a lottery system with every eligible unit having an equal probability of selection. A randomized assignment also ensures both internal and external validity of impact evaluation, provided the evaluation sample is large enough. Internal validity means that the estimated impact of a program is the net sum of all potential confounding factors and the control group representing true counterfactual. This ensures that once the program starts, the comparison group is exposed to the same set of external factors over time except the program. Hence, any differences in outcomes between the treatment and comparison groups can only be due to the existence of program. The external validity, on the other hand, means that impact estimated in the evaluation sample can be generalized to the population of all eligible units, or the evaluation sample a representative of the population of eligible units. Thus, the evaluation sample must be selected from the population by using one of several variations of random sampling. Some of the impact evaluation methods are randomized assignment, randomized promotion, regression discontinuity design, difference in differences, and matching. These methods could also be combined by evaluator. Each method has its own pros and cons, especially the risk of bias, which gets reduced by combining methods. Complications arise when programs have multifaceted aspects of implementation or multiple treatments. Evaluation of such programs are done using crossover designs or cross-cutting design. Some of the impact evaluation case studies that one can read an impact of Mahatma Gandhi National Rural Employment Guarantee Act (MNREGA) on agriculture using the difference in difference method, impact of MNREGA on rural agricultural wages in South India, and IIM Ahmedabad impact assessment study of e-government projects in India, which was in 2007. Now we conclude the model. Impact evaluations are costly exercise and not all programs need an impact evaluation. A program affecting few people are not needing a huge budget like volunteer programs may not need an impact evaluation. Such evaluations cannot be conducted in isolation from other sources of information like the nature and the content of programs to contextualize evaluation results. Certain results may or may not be achieved. Also, impact evaluations are not typically designed to provide insights into programs implementation, though are guided by information on how, when, and where the program under evaluation for being implemented. As Lars, Gilkey, Hattori, and Angelis in their 2014 A Guide to Statistical Methods for Program Impact Evaluation state, the aim of the program impact evaluation is to learn whether and to what degree a program altered outcomes from what otherwise might have been prevailed. Measuring what might otherwise have prevailed is a challenging task. There is no gold standard methods of impact evaluation. All the methods involve assumptions, not all of which are testable, that allow one to interpret the estimates generated by them as program impact, or more broadly, as reflecting a causal relationship. Some present inherent limitations in terms of the parameters that can be estimated. This is why careful impact evaluation work is so important. One must have a good sense of institutional and environmental framework in which a program operates, as well as a good understanding of the design and procedures of the program itself and the types of populations motivated to participate and why they would be. This allows the evaluator to have an informed sense of what assumptions are probably reasonable and hence which impact evaluation methods might be preferred and how much weight to assign the estimates generated by them. It is true that even then assumptions, or at least certainly untestable assumptions, are glorified opinions, but they will at least be informed opinions. Thank you.